All right, let's get into this one. So we've got a 25-year-old female who comes in with this left-sided loin to groin pain, and it's really bothering her. Naturally, you start thinking about things like renal colic, maybe ovarian pathology, but let's not jump ahead just yet. We've got some imaging here to guide us. I'm looking at the frontal radiographs of the abdomen and pelvis, and right away something catches my eye. There's this well-defined fat density lesion, about 10 centimeters in size, sitting right over the mid-pelvis. Now that's not your typical finding, is it? When you see something like this, it's a big clue, especially when we dive into the details a bit more. In the middle of this lesion, we've got multiple dense calcifications, and what makes this interesting is that these calcifications have dental morphology. You can literally make out crowns and roots. Yup, you're seeing teeth. And if that wasn't enough, there are some more amorphous areas of calcification adjacent to those dental structures. The rest of the radiograph looks pretty unremarkable, though. Normal bowel gas pattern, no renal tract calcifications, and the renal outlines along with the psoas shadows are all clear. There's also no bony abnormality to worry about. So what are we looking at here? Well, everything is screaming ovarian dermoid. Classic, right? These dermoids are benign tumors, and what makes them fascinating is that they can contain all sorts of stuff. Hair, fat, bone, teeth, you name it. And in this case, we're seeing exactly that. But then there's the pain. Pain isn't usually the biggest presenting feature with these unless something's gone wrong, like torsion or infarction, both of which can cause significant discomfort. Given her presentation with acute pain, we've got to think about the possibility of torsion. But hey, it's also possible that there's another reason behind the pain, and maybe the dermoid is just an incidental finding. Malignant transformation? It's possible, but far less likely in someone this age, and I'm not seeing anything else on the images to make me jump to that conclusion. So where do we go from here? Well, the next step is definitely gynecology referral. They'll want to get in there and either laparoscopically remove or excise this dermoid. To get a clearer picture of the ovaries, a pelvic ultrasound will be key. It'll help us assess for complications like torsion, or even see if there's any other pathology that might be behind her pain. And if we're still not sure after that, we could go for a CT scan. CT is going to give us more clarity, especially if we're worried about something more sinister. But I've got to say, right now, my money's on this being a straightforward dermoid, with the pain likely coming from torsion or another benign issue. In this case, our patient was actually referred to gynecology, and they ended up doing laparoscopic resection. The histology came back showing a benign ovarian dermoid. No surprises there. Interestingly, the dermoid hadn't twisted or bled, so the cause of her pain was still a bit of a mystery. But thankfully, no serious complications. Now, just a quick word on ovarian dermoids, because they're kind of fascinating. These tumors, also known as mature teratomas, are some of the most common benign ovarian tumors in younger women, especially those under 45 years of age. What's cool, or creepy, depending on how you look at it, is that they can contain all sorts of mature tissue: fat, hair, neural tissue, even bone and teeth. Just like we saw in this case. Most of the time, these dermoids are benign, but in rare cases, they can undergo malignant transformation. It's unusual, but when it happens, they tend to become squamous cell carcinomas. There are even reports of melanomas or malignant germ cell tumors arising from these dermoids, but again, that's quite rare. Complications like torsion are actually more common than malignancy, especially in larger dermoids. When they twist, that's when you get that acute onset pain, which could explain what was going on with our patient here. Okay, that wraps it up for this case. Dermoids are just one of those things that can surprise you on imaging with their weird but distinctive features. If you enjoyed this case, or if you've seen something similar in your practice, drop a comment below. And don't forget to hit that subscribe button for more cases like this on Radiology Made Easy. Thanks for tuning in.